That's where we're looking at the moment. Hi, Miss Deborah. My name is Ife Omar, and I'm going to be your nurse practitioner student. I will be assessing you today. We're going to be doing cardiovascular and the peripheral examination today. Do I have your consent to do this examination on a video and then put it on the YouTube under unlisted so my instructor can see that? Is that correct?
Yes.
Thank you. So I usually will start my exam by washing my hands, which I already did wash my hands, and I will come in, and the first thing I'm going to do to my patient is I am going to take her blood pressure. I'm going to take the blood pressure on both hands. I'm going to take it with her sitting down, with her laying supine, and which we usually call the orthostatic blood pressure, and I will have to compare, for me to compare this blood pressure. So when I finish that, the next thing I'm going to be doing is the inspection of her neck. I am going to be inspecting her neck, and I would like you to lay down, and in this point I put my patient laying down in the supine position. When she is laying in the supine position, I will ask her to look to one side, and I am inspecting my patient. I'm inspecting her for any discoloration, inspecting the pulsation, and checking to see if there is any jugular vein distension on this patient, which looking at her, there is none. We look on both sides of it. Yeah, so I can see some pulsation down here, which is good, because if she have a jugular vein distension, it's going to be up here. It will be all be filled, which usually is a sign of heart failure. So I will get a straight stuff, and I will measure it from the notch of the patient. I will have to put this straight, and then we'll any straight stuff, and then I will measure it from the notch. And for this patient, I have 2. Anything less than 3 is considered a normal. I have 2 centimeter, and anything less than 3 centimeter is considered normal. Because so this patient is normal, and then I will also do the same on this other side. At this point, I am going to also be auscultating my patient on this in the carotid artery. So I am auscultating for any bruit, and will be using my stethoscope, and will auscultate and auscultate for any bruit on this patient. I will also palpate and make sure that when you're palpating, that you're palpating on one side at a time, because if you palpate on both sides, you tend to lose blood circulation on this patient, blood flow to the brain on this patient. So you don't want to palpate both sides at the same time. So I will palpate this side. I'm looking for any lumps or any feeling for the bruits. So for the bruits and the trail. So, and if the blood pressure is high, we also have to palpate and listen at the same time with this patient, because we are looking at the upstroke of this particular patient. So the next thing that I'm going to be doing is I will have to move down to her chest area, which is so I will be looking at the chest. I will be inspecting this chest for any impulse visibility, so any pulsation, and I'm also inspecting it for any symmetry or any depression. At this point, I don't see any kind of abnormalities. So I will go ahead and listen to my patient. So before I listen, I will have to auscultate. And we no longer auscultate patient in the front, which we auscultate her in the back of the of the church. So I will go ahead when you are palpating this. This is my second intercostal space, and this is my on the right side. And also, if you are doing a cardiac examination, it's good for you to stand on the right side of the patient because it helps you to see the pulsation very well. So then this is the second intercostal space on the right side, and then this is the second intercostal space on the left side, and then we have the third intercostal space on the left. Then we have the fourth intercostal space, and then the fifth intercostal space. So the fifth intercostal space is also known as the apex point. So at this point, I will palpate the point of maximal tensity, which is the PMI. So I am going to be palpating that for any lift, any laves, any haves. So I will ask the patient. So the point of maximal is on this side. So can you lay for me on the side, just on the side like this? So I am palpating here for. This is the point of maximum, my PMI. So that is my point of maximum listening. So I will at the same time also, if you don't mind laying on your back now, I will also at this point palpate the abdominal, and the abdomen I will be looking for the inspecting the abdomen, then the aortic and the iliac arteries. So the aortic is above the umbilicus, which is here, and her umbilicus is right here, so the aortic is above it, and then the iliac, it's there, and then the renal arteries, and we have the femoral down here. If it's in the real clinical world, this exam has to be done without clothes covering her, so we have to put a pants, and then I will have to palpate the aortic, iliac, renal, and the femoral arteries. So I'll palpate that, and the same thing. So now at this point, I would say that the normal is +2, so which I can feel for her because she is a normal patient, so she's +2. That's the grading for this iliac aortic for her. So the next thing that I will be doing is auscultating the patient. So I am going to auscultate in those 4 areas, which is the aortic, pulmonic, tricuspid, and mitral valve. So I will, and then the 5 and the Ebbs point. So I will go down to, this is my second intercostal space on the right. This is my second intercostal space on the left. And then I go to the third intercostal space, my fourth intercostal space, which is, and then I go into my the fifth intercostal space on the mid-clavicular line, and the same thing I will also do to the back of the patient. And it's always good to listen side by side of this patient, which my patient is normal, because when you listen side by side, you are comparing the sound that you hear when you go back there. So, and I am listening for any kind of S1, S2, S3, and S4. And any abnormalities in some patients, S3 is normal for them. And also listen for any abnormalities like S2 split, which S2 split could be as a result of the S1 and S2 closing separately. So the S1 closing, and then in between the S2 opening. So that's one thing that I'm going to be listening for, the split, which in some people it's considered normal, in some it's not. So after that, I will also have my patient to sit up. Can you sit up, please? I am going to ask her to sit up, and I will do the same thing, listening. I will also listen with my diaphragm and with my bell on each of the areas. The second intercostal space with my diaphragm, and then with my bell. And then I'll go to the second intercostal space with my diaphragm and my bell. And I will go to the third intercostal space with my diaphragm and my bell. Then I will go to the fourth intercostal space with my diaphragm and my bell. And I will go to the fifth intercostal space with my diaphragm and my bell. And I am listening for any murmur, any abnormal sounds, which I didn't see. I didn't hear any. The next I am going to do is I'm going to ask the patient to lean forward, and at this point I'm looking for a soft intensity insufficiency murmur, which you can hear when patient lean forward and take it up a deep breath. So I'm going to do the same on those areas that I am. So I'm going to listen on the second intercostal space, which is my aortic, with my diaphragm and the bell. I'm going to do the same also in the pulmonic with my diaphragm and the bell. And I'm going to do the same in my tricuspid with the diaphragm and the bell. I'm going to do the same in the apex point with the diaphragm and the bell. I'm going to go up to the apex, the mitral valve. I'm going to use my diaphragm and the bell, and I will listen to this. And at this point, my patient is good. I didn't hear any of those murmur, so she is fine. And the next the exam that I'm going to do is a peripheral examination. And in the peripheral examination, I'm going to start by inspection like we do as usual. I am going to be inspecting the upper extremities. So I'm inspecting it for any coloration, any cyanosis. I'm inspecting it for any splints, any hemorrhage, or any tar staining. I am also trying to make sure that there is symmetry in both upper extremities. So then I am going to, at this point, be looking for her radial pulse. The radial pulse is right here. So I'm looking for her radial pulse, and at this point I can feel her radial pulse going in. So I will grade this radial point as +2 because it's normal and it's expected. I will also feel her brachial pulse right here, and yeah, I'm going to pull your shirt a little bit and see. Okay. Okay. So it's a little bit hard to pull the shirt she's wearing. So but if I can feel it, I will also feel it, which I think she also has +2 because she's a healthy patient. Is expected. +2 is what is expected. +3 is bounding, and the 1 is weak. So I will do the same also on the left hand. I'm feeling for the radial pulse, and On this side also, I can feel a +2 on this radial pulse, which is normal and expected. On this side, like the brachial, I can feel it with her clothes on. But if I can feel it, which I think it should be +2 also, because she's normal and do not have any cardiovascular issues. So like I said earlier, 2 is normal and expected, 3 is bounding, and 1 is considered weak. So can you lay down for me, please? So while she's laying down, I want to do the lower extremities. So just as usual, I will also start with inspection. We inspect for edema, we inspect for symmetry, we inspect for any discoloration, any abnormalities, like if there's any varicose vein on the leg, any shunt. So that is what I'm inspecting. So, and at this point will be a good time to check her popliteal pulse. So I'm going to ask patient to lift her legs up a little bit. So you're going to use your 2 hands and you're going to palpate for the popliteal pulse on this patient. And if you're doing this, there is need to pull the clothes up so I can feel it better without clothes. So, and this will also be graded. Oh, I can feel it here. Yep. So I can say this is like +2 what I can feel. So you can also, then I have to do the same on this other leg. So if patient is wearing clothes, it's a good time to just pull it up and do that. If it's in the real clinical world, so we provide privacy and we're able to pull the clothes up. But for this patient, she does not want that, so we don't want to expose her on the camera. So thank you. If you can straighten your legs for me. So it's a good time also for me to check the capillary refill for both upper extremity and the lower extremity. So checking the capillary refill, then you put a pressure on the toe nail, and it's supposed to bounce back with you. If it does not bounce back in less than 3 seconds, it's considered abnormal. So, and the patient's own is normal, it bounced back immediately. So I'm going to do the same on her fingers, and it bounced back right away, which is considered normal. So the next thing that I will be doing for this patient is what we call the Homan sign. And the Homan sign, I am at this point I am checking for DVT. It's a way for us to rule DVT. So I am going to ask the patient to flex, dorsiflex, and I am at the same time as she dorsiflex, I will be palpating her calf and asking her, do you have any tenderness or any pain? Patient is not supposed to have any tenderness or any kind of pain, but where there is tenderness and pain, that could be as a result of DVT, and further investigation need to be done. And you do the same thing over here. And as a matter of fact, I'm supposed to put on a gloves because I'm touching a patient's foot. You don't need to do that without a glove like I'm doing it right now. So you dorsiflex and then you palpate the feet. Do you have any pain as I palpate? No. So patients do not have any pain. And there is one other thing I have to be checking down here. I'm going to be checking the dorsal pedals pulse on her legs. So this is +2. Most times it's good to check it at the same time you're looking at both the other pulse, so that way you can feel the difference, because you want to know if this other side is +2 and this other one is weak or something. So, and that's what I did, but they are all equal. And I'm going to be checking also the posterior tibal pulse, so which is the inner part right here. So for this patient, I have +2, and this leg, which is normal and expected. And the same I have on this side also, which is normal and expected for a patient like this. So at this point, that brings me to the end of the cardiovascular examination today. Thank you, ma'am, for letting me do this on you.
You're welcome.
Bye.